Okay, good afternoon. This is Dr. Geriatrics for MED260, and I'm just going to talk briefly, just going over the outline, and I already put it on Moodle. Chapter 41, the geriatric patient or assisting in geriatrics. And of course, since we have a specialty for children, we have also a specialty for our older population. So let's look at some things that we should be aware of. One thing that you really need to know are the physical changes of aging. So those are the changes that are in the integumentary system. Let me zoom in. Okay. Integumentary system. Changes in the nervous system. And again, even though you could see here slower reaction, decreased blood flow, shortened attention span, that kind of thing, and memory loss or dementia, okay? And because when you get older, you're going to have a decrease of acetylcholine, and we already know that decrease in neurotransmitter, decrease in also hormones can also decrease the decrease in function. So those are some things to consider in your geriatric patient. Now, what I always said that regarding in the aging process or the nervous system, that if you do not use it, you lose it. So if you don't keep your mind active and your body active, what will tend to happen? These things that we just mentioned, which are an eventuality for all of us, will happen to you quicker and will be more progressive. Meaning to say is you'll start falling apart a lot quicker and a lot younger. So being in healthcare and being in a job where you have to use your brain, such as healthcare, is really important. There are also some special changes, impaired vision and hearing. It's part and parcel of growing older, right? But more so osteoporosis, and osteoarthritis. OA, degenerative joint, also known as DJD, which is degenerative joint disease, and osteoporosis, decreased bone density, because we all know that what makes our bones hard is a magnesium sulfate and calcium, and that gets leaked out of your system the older you get, and especially osteoporosis more for your female patient who's had children. Cardiovascular system, of course, you keep on eating those Doritos, you get arteriosclerosis and other related stuff, diabetes, respiratory, immune, digestive. Just go over them and know in general, you know, what tends to happen to you over time. Another thing for the musculoskeletal, let's pan out and look at this, right? You can see the changes. You know how some people say, oh, when I get older, you know, I'm going to get shorter. Yep, you do, because look at the lateral curvature of the spine, and you're going to get something called kyphosis, which is right here, also known as humpback, right? So I have a humpback right there. Okay. Now, know some of your cognitive and intellectual changes. We talked about that. Know what dementia is. Look up Alzheimer's. Now, psycho-emotional, right? Significant life changes. And for a male patient is usually death of a spouse, but for both patients. But it tends, statistically, it tends to affect the male patient more than the female patient. And also the other fact, remember the stories I always tell you guys, the second you retire, you should go into, you know, something that, you know, doesn't necessarily mean you should stop working. You should still be in the workforce, because that's part of the psychosocial, psycho-emotional changes for the negative, okay? Because like I mentioned in my notes, for many people, work defines who they are, and then when they no longer work, then, you know, they kind of lose perspective on who they are and their importance in society. Look at some aspects of care, right, based on some of the signs and symptoms of aging. Look up assisting with geriatric care. Now, by the way, the pages that are on my notes shouldn't match to the pages of your textbook because it was an older version. For example, look on page 501 for patient education bullet points. Well, it isn't 501 because I'm right now on page 832. Now, you don't need to know the diseases and the descriptions and the treatments because that's a pathology class, which this is not. But this points on practice, this right here, I want you to know this section as well because the communication with the geriatric patient, right? Private setting, right? For they may have some difficulty hearing, okay? Look at the patient directly, right? Show some respect. You can also need to be patient because it might take them a minute or two to formulate an answer. So look over these. They're pretty straightforward, and they're also important. Education of the geriatric patient. Sleep orders, you know, as you get older, you get harder to sleep, and there's a little bit atherosclerosis here. All right. Many things here that we talked about in MED260. Again, get older, you get incontinence. That means you tend to leak urine, right? It's embarrassing, and also the fact that you've been taking care of yourself all your life, and now things start falling apart a little bit. Okay. Special concerns, preventing falls, very, very important, because as you get older, and again, you have some osteoporosis, some osteoarthritis, your bones can't take a hit like they used to when you were younger. So you got to be careful when you walk around. And there's all these lovely points here, which, by the way, was on the RMA, the Registered Medical Assisting Prep Test. This was on there, like what is a geriatric patient concern. Elder abuse, we went through this several times. This is, your job is to gather the data. Your job is not to report it to the police or the CPS. You report it up your chain of command, right? And you make sure something gets done through your chain of command. Excuse me, a little bit yawny, if that's a word. Polypharmacy, where is it? Right here. Polypharmacy, remember, more problems, more meds. Okay? So we try not to gauge in polypharmacy, but sometimes it happens. Okay? Too many meds. Okay? Read this section here on unsafe polypharmacy. Really important, right? How do you keep all these medications straight, right? And last but not least, hydration. Look at this procedure right here, educating adult patients about daily water requirements. In the beginning of this particular chapter, we talked about certain considerations, and one of those main considerations is dehydration. Okay, so your patient really has to hydrate. Okay, so know the signs and symptoms and all that stuff, and it's all right here in procedure 41-1. Okay, and I think that's pretty much the synopsis of chapter 41, the geriatric patient. Alrighty? Okay, and I'll see all y'all in class.